Hi, Senator McCain. My name is Katrina Fritz. I'm a nurse here. I work in cardiac quality. And in light of what Dr. Singer just said, which is very true, two-part question. How do you feel about preventive care? Because honestly, that's what keeps us from getting into those problems. And if you would not become the president, how would you feel about expressing those viewpoints that you have that are very good? I've heard you talk, and I agree a lot with what you said. How would you work with whoever became the president?
Thank you. Let me just, by beginning to state the obvious that our friends in the healthcare profession know, and one of the most alarming statistics in America today is the increase, obesity, high blood pressure, and diabetes amongst young Americans. There's no healthcare system in the world that can sustain the costs of a continued increase in just those three aspects of America's health, it's impossible to reduce the cost of healthcare in America if that's the case. But more importantly, we are, as we have seen through many, many years and maybe centuries, an increase in the lifespan of Americans that could level off because of the health and wellness of another generation of Americans. I would like to see everything ranging from insurance companies rewarding their clients for wellness and fitness, to employers rewarding their employees. If they join a health club, they would pay their dues. The insurance companies would give reduced premiums to people who obviously have displayed wellness and fitness, etc., so that there's incentives financially. But also, I'd love to see, and I know that this is a little utopian, but I know that young Americans like and admire and respect me, those that know me, at least I hope that most of them do. But the people they really look up to in America are our great athletes. And I'd love to see my friend Shaquille O'Neal, who just finished the playoffs last night, as the Phoenix Suns were defeated by the San Antonio Spurs again, he inaugurated a program in Miami when he was a member of the Miami Heat, and it was called Shaq's Challenge. And I had, at Miami Children's Hospital, a chance to meet a young man who had lost 76 pounds, who had taken up Shaq's Challenge. And by exercise and by dieting, this young man was in good health today. Now, in all due respect to my prestige and influence, I'm not sure he would have taken up Mac's challenge. You see what I mean? So I'd love to see our great athletes, who young Americans and women athletes that young women look up to and admire, and all people that are admired by young people, to go around to the schools in America and talk to them and try to motivate them, and that we lay out programs that they can follow and give them diets that they can follow. And I understand the other thing I'd like to have parents do is go to their school and find out what's in the school lunch program. And I'd also like to have parents and school board members find out what the physical education requirements are or program is in schools in America today. But for older Americans that are out of school, then I think we've got to put in specific incentives for people to practice wellness and fitness. And I just want to add one other point. I'm sorry for over-answering, but I really believe that this is one of the crucial aspects of providing available and affordable health care to all Americans, and that's smoking. My friends, I smoked for a long time. It used to be the thing that Navy pilots did. It was part of our sort of image. I'm happy to say I quit many years ago. I'm also unhappy to tell you I still want a cigarette, but I haven't had one in 30 years, 20-some years since I've had one. But smoking is really, really unfortunate, especially with some young Americans on the rise. And we have taxes on cigarettes, as you know, today. And that money, instead of going to programs to disincentivize young Americans to smoke and treatment of tobacco-related illnesses, it's going into general revenues. And it was supposed to be going, the tax that's paid on a pack of cigarettes was supposed to be going to these programs, and it's not. And I think we should demand that it be so. And they have proven in some states where there is active anti-tobacco use programs that they've been successful. They've been successful. So it's not a question of whether they work or not. It's whether we're going to devote those funds, which are specifically imposed on the sale of tobacco products, to be devoted to those programs, including the treatment of tobacco-related illnesses. So, wellness and fitness. Wellness and fitness. Yes, sir.